Hi guys, welcome to our abdomen gross anatomy. So today we're going to talk about the internal anterior-abdominal wall. So this structure you are seeing here, we are seeing the anterior-lateral abdominal wall from the inside, right? So let's mark the boundary or a landmark that is very important. What plane is this that I'm highlighting? This is your transumbilical plane. The region above the transumbilical plane, that's your supraumbilical region. The region below, infraumbilical region. So in the infraumbilical region, you're going to see what you call five umbilical folds, right? One in the median plane, two medial umbilical folds, and two lateral umbilical folds. So that is what we are going to talk about. So let's take a zoom. Good. Right. So this is your umbilicus, and you can appreciate this is what your tendinous intersection. So this is where our plane lies in this line, and then we are focusing on this region. Right here in the middle, this is what you call your median umbilical fold because it is in the median plane. So the median umbilical fold is a remnant of the urachus or something that was once known as the allantois. So you can actually see this is your bladder. At the apex of your bladder, you have this urachus. So it was once an allantois before, and it obliterated to form this fold. So the median umbilical fold is made by the urachus or the allantois. You understand? Good. And then we are going to have this one and this one. These are your medial NB, medial umbilical folds. The medial umbilical folds are formed by the obliterated umbilical arteries. So remember, in the umbilicus, that's where your umbilical cord was found. And in the umbilical cord, there was an umbilical vein that I'm going to talk about and two umbilical arteries. So when these two umbilical arteries leave the umbilical cord, they will move in this orientation, right? So that is going to be your medial umbilical cord made by umbilical arteries. Then we are going to have another fold which is called a lateral umbilical fold. Lateral umbilical fold, there are two of them, right, left, and right. Good. The lateral umbilical fold is going to be made of the inferior epigastric artery and inferior epigastric vein. Inferior epigastric artery and the inferior epigastric vein. Do you remember where the inferior epigastric artery coming from? Yes, it's coming from, it's a branch of the external iliac artery. Right. So this one, the inferior epigastric artery and vein, forms the lateral umbilical fold. NB, important point. When the lateral umbilical cord is cut, it bleeds, which means it has live arteries and vein. But all of these, if they are cut, they don't bleed. This one is obliterated, obliterated, obliterated. But this one, it's alive. So if the lateral umbilical cord fold is cut, it bleed. That is true. That is true. Right, so there are inguinal areas that you also have to take note. Remember, this is your median umbilical fold. The area that is lateral to the median umbilical fold, this area is going to be called your supravascular region or your supravascular fossa, right? And then remember, this one is your medial umbilical fold of the umbilical arteries, remember. Then the area that is lateral to this medial umbilical fold, this area is going to be your medial inguinal fossa, right? Your medial inguinal fossa. And then the area that is lateral to the lateral umbilical fold is going to be called your lateral inguinal fossa. So lateral inguinal fossa, medial inguinal fossa, supravascular fossa. So there is an important triangle that is very important that is found in the medial inguinal fossa, right? That is called a inguinal triangle or a Hazelbeck's triangle. This triangle, it's a common site for direct hernia. Direct inguinal hernia, it occurs in this Hazelbeck triangle in the medial inguinal fossa. So what is important is to take note the boundaries the of the Hazelbeck triangle. Let's take a note. So since it is a triangle, you're going to have to understand that it has this medial border, lateral border, and base. So take note. The medial border is made by the linea semilunaris of the rectus abdominis, or just the lateral edge of the rectus abdominis. So you can actually see this is rectus abdominis, and this lateral edge is called the linea seminularis, right? Also called the lateral edge of the rectus abdominis, who form the medial border of the Hazelbeck triangle. And lateral border, the lateral border is going to be made of the lateral inguinal fold, which means it's going to be made of the inferior epigastric vessels. And then the base is actually made of the inguinal ligament. So let's try it over again. Sorry. Let's try it over again. So this is the base made by the inguinal ligament. The medial border made by the linea seminularis or the edge of the rectus abdominis. The lateral border is made by the lateral umbilical fold, which is the inferior epigastric vessels. A common site for direct inguinal hernia, which is less common. And this space, take note this space, which we say this is your lateral umbilical fossa, your lateral inguinal fossa, sorry. That's where you're going to find the deep ring of the inguinal canal. So the deep ring of the inguinal canal is a lateral to the lateral umbilical fold. So that is a common site for indirect inguinal hernia, which is most common. You understand? So most common hernia is indirect. Where does it occur? In the lateral inguinal fossa, right? Just a lateral to the umbilical fold. That's why we have the deep inguinal ring. Medial to the lateral inguinal fold, medial to it, that's where you find the inguinal, the Hazelbeck triangle for direct inguinal hernia, which is less common. You understand now? Good. So let's take now, let's go now into the supraumbilical region. Your supraumbilical region. Right, so this is your umbilicus, and above the umbilicus, we have the supraumbilical region. So you're going to find if, there's going to be your liver right here, and your liver is going to be attached to the anterior abdominal wall via what you call a falciform ligament. And on the free edge of the falciform ligament, you're going to have your ligamentum teres hepatis, which is the round ligament of the liver. And it's going to be accompanied by paraumbilical veins, if you remember. So this fold is going to be made by the umbilical vein. Remember, when the umbilical vein obliterates, it's going to form the ligamentum teres hepatis, which is the round ligament. Let's take a look at the previous diagram. Right, so this is your falciform ligament. On the free edge of the falciform ligament, you have the round ligament of the liver right here. That is the remnant of the obliterated umbilical vein. Right, so let's go for a summary. So infraumbilical region, you have the median plane. Median plane, you have the median umbilical fold made by the urachus. And then you have the medial umbilical fold made by the umbilical arteries. And then you have the lateral umbilical fold made by the inferior epigastric arteries and vein. And then in the supraumbilical region, you have your ligamentum teres hepatis, accompanied by the paraumbilical vein going to drain to the portal vein. Thank you so much, guys. Take care.